Vaccine confidence is taking a hit these days. What can we do to help support healthcare professionals in being able to have the confidence to have those conversations, to make those recommendations to their patients and to their peers, and help support them in raising vaccination rates across the country? That, we believe, is part of our mandate, especially what I do in medical affairs, is to help support healthcare professionals and public health, understand the data, the information, and really be able to give that recommendation, to have the confidence in what we're doing in terms of our research and development.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo, or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 402. Today we have the Flava of the Week reflecting on the week of March 15th, 2020. How can we reflect on the past so it doesn't take a pandemic next time to prepare for our future? I'll talk about that. Then we welcome James Mansi, Vice President of Medical Affairs at Moderna, on the 5-year anniversary of COVID lockdown. Our conversation goes some places you might not expect, including how we can drive innovation at a faster pace again, and where Moderna is focusing for the next 12 months. It's time for the awesomeness. Are you ready? Let's go.
Flava of the Week.
5 years since COVID lockdown. There's a lot we don't want to remember about the week of March 15th, 2020, but some things emerged from the darkness that I hope we never forget. We each have memories clearly etched from that dark period. I can tell you exactly where I was while listening to the radio broadcast of the NBA shutting down in real time. I remember learning that a new client wouldn't be starting as a client after all because their manufacturing facility was located overseas in a town called Wuhan, China, and they weren't even sure they would have a business anymore. I remember what turned out to be the last time to eat out at a restaurant for months, and then there were our kids not going back to school after spring break. I learned how much I would miss being in public places with other fellow human beings, how much I disliked eating takeout in my car, and how important it was to check in more frequently with my extended family. You remember where you were too, don't you? It isn't easy to look back, but at the same time, there are a few things that emerged from the darkness that I wish we still felt as strongly about today. You might have a list of your own. Here are a few of mine. First, the deeper desire for connection. The desire to stay connected propelled new connections and communities. LinkedIn became a virtual safe place to connect with people about work, a nonpartisan and semi-universal topic. A colleague asked if I could create a LinkedIn group for Marcom leaders to share resources for tackling the outbreak so hospitals could expedite relief efforts by learning from each other and not reinventing the wheel. This same period marked the formation of the Consumer First Health Group, which started with just 5 friends trying to make sense of the insanity and has seen hundreds of leaders participate in our Real Talk monthly chats. Second, the expedited innovation mindset. I really miss the days of standing up virtual care and other digital health programs in a matter of weeks or even days. Today, we're clearly back to sales cycles of 12, 18, or even 24 months, and we seem to accept roadmaps that dangle products in front of us that won't be available for another 3 to 5 years. Innovation is held up at every turn now, and quite frankly, it's a shame. I, along with many of you, will continue to push the industry to challenge these timelines. Third, the desire to meet consumers' expectations in new, transformative ways. Of course, I was going to mention this one. Those paying attention to the consumer experience space saw a clear delineation in pre- and post-COVID expectations for how a digital experience should go. Up until 2020, healthcare debatably got a pass, just like restaurants and retail stores weren't expected to have curbside pickup. But in the same way that we now have more options for buying consumer goods that don't involve going into a store, expectations will never go back, which means healthcare doesn't get a pass anymore. People demand better. They demand products, services, and experiences that more greatly meet their demands for safety, convenience, simplicity, and ease. We have no choice, and we have to deliver. Finally, the safe spaces for learning about ourselves as humans. Up until 2020, I had never seen an openness to discuss macro societal mental health challenges such as anxiety, loneliness, and what truly makes us happy. But then we had no choice other than to talk about it. And that opened up new opportunities to shine a spotlight on basic human emotions and collective experiences that it turns out determine to a large degree how much we thrive as a species. I was fortunate during that time to produce a number of podcasts that featured people of all walks of life finding connection in the chaos. They were discovering in times of great loss, and they taught me so much about myself and how to help others find their place in a rapidly evolving world. I don't ever want to go through lockdown again. It was one of the greatest struggles I've ever had to endure. And that's exactly why I don't want to lose the few things that we gained during those months and years. And that's why I'll continue to use this podcast to connect with you as human beings and push for innovation in our industry. I encourage you to each find your own way to reflect on the past so that next time it doesn't take a pandemic for us to prepare for our future. That's another way that we'll build the healthcare of tomorrow. And that's the Flava of the Week. All right, everyone, let's get into the flow. Please give it up for my guest this week. I'm here with James Mansi. James is the VP of Medical Affairs at Moderna. Yeah, that Moderna. This is a really unique opportunity. We were just talking off camera. We don't always have big, significant, life-changing, society-changing anniversary to talk about every episode, but we do today because this episode is being released during the week of March 15th. I think if anyone thinks, you don't have to think too hard about what happened 5 years ago, March 15th. So let's get into that, though. Let's give James a chance quickly to introduce himself. Hey, welcome to the Healthcare Wrap.
Thank you, Jared. It's such a pleasure. Thank you for having me.
Yeah. Hey, we always like to help our listeners get to know you a little bit better. What's something they might not know about you just based on your title and previous experience? What's something that would be interesting for our listeners to know about you?
Well, I don't know about interesting, but I have an absolute love for the Highland bagpipes.
Really?
And so much, to the point where I have them on my playlists. I listen to them in the car, on walks and whatnot. And so much so, I decided to try and learn how to play them, and starting with a chanter. I haven't always dedicated enough time to practicing, and in my head, I hear that music. I hear the pipes in the outdoors, and what comes out, it's more akin to the shrieking of cats. And I remain undeterred, but for my wife and family, they wish I would change to something a little bit more quiet.
Now, and you're based out of Montreal?
Yeah, my home's in Montreal in Canada, and I've been dedicating the last 3 years to helping to support and work with my colleagues, friends, and the community at large in the United States.
Fantastic. Speaking of, let's talk about some of that work. Can you describe your role at Moderna, a VP of Medical Affairs? What does that involve?
I play a role, and my team plays a role in bridging our research and development group to implementation. It's for me, I know you often have people who say, I have the best job in the world. I really believe I have the best job in the world. I sit at the interface of research and development, but we work to make it practical and pragmatic. The so what? We bring the evidence to healthcare professionals and public health to support their understanding of how our research and vaccines and therapeutics can really help improve the lives for their patients and support their public health objectives. In the end, Jared, and this is something that we live to, it's great vaccines don't save lives. Vaccination does, and the ability to support public health objectives saves lives. If we can't get it from the fridge to the arm, it's not working. So that's our role. That's where we come in, that interface, that translational interface.
I love being able to put it that concisely, but I know there's so much behind that. So let's set the stage for our conversation here. As I mentioned, this episode is being released the week of March 15th, right? We're recording it a little bit earlier, but March 15th marks a couple of significant things, namely what we were alluding to earlier, the 5-year anniversary of COVID shutdowns, as well as Long COVID Awareness Day and Long COVID Awareness Month. So a lot packed in there, right? I think there's a lot of pieces of when we look back at 2020, a lot of things that we may not as a society or individually want to relive or remember. And yet there were a lot of pieces of how things transpired when we look back. We've had a chance to reflect on what we went through collectively as a society, where we are today versus there. I think maybe we can start with the shutdowns piece. When you look back, what do you remember about those early days? I can definitely tell you the exact point, like the exact place I was. where I first learned about shutdown happening, in multiple, like not just something small here or there, but official shutdown happening, and life was changing at that point. Like, what are some of those things you remembered in those early days of the pandemic?
I can remember distinctly where I was and that feeling. I was actually away. I was at a meeting in Florida, actually, and everything started shutting down, and you were getting alerts on your phone and flights getting canceled. I remember that evening looking around, and it was Miami. It's an active, vibrant city. That evening was not so active, not so vibrant. It really hit home, and being able to get back in time, but really living it, not just the statistics, not just what we were seeing coming from the WHO, the CDC, other health organizations, but actually in the moment, I really started to, okay, this is real. I now understand it. I'm living it firsthand now. For the first time, masking up on a flight, people almost gowning up on a flight because we didn't know anything at the time, right? A lot's gone on, a lot of understanding and experimentation in terms of what works in terms of that public health interventions. How do we adjust to what we were living in that moment? I remember that deep concern around the safety for my friends, for my family, but not just the physical, but also the mental. My goodness, what is this lockdown going to do for our social? My kids at the time were in high school. The social interactions, the getting together with friends, everything turned off. But what gave me hope was seeing how our communities rallied together. We supported each other like we never did before. We took for granted the ability to just walk outside, have a quick chat with our neighbor, go see our families, spend some time at a coffee shop or over a meal. And we turned that into caring for one another in a remote, in an interactive, yet different platform. It gave me confidence in our resilience and our humanity. I remember one evening, even when we all sat outside in our driveways to share a meal, and we even have an extended family dinners via Zoom. The adaptability, the resilience of all of us, of humanity, is what I will remember. And it made me cherish and not to take for granted opportunities to connect with my family, with my friends, with my community. I cherish those moments now more than ever because I know they're not a given. This can happen again. And that's one of the lessons. And then I remember, Jared, what made me come to Moderna was I need to do something. I want to do something. And what better place than coming to Moderna, who we were at the forefront of the delivery of a vaccine that changed the course of the pandemic. I remember when the COVID vaccines came out, the excitement around this vaccine and the promise that they brought in terms of getting us out of our lockdowns, relieving that burden on the health system and reducing the tide. That's a tidal wave over morbidity and mortality. I was bringing my then 87-year-old mom for her COVID vaccine and brimming with joy and the excitement of bringing her all masked up, the distancing, as you'll remember, and then getting her that vaccine and saying, you know what? I think we've turned the corner. I am optimistic with this. And then going with my wife, Kelly, and our children to get our vaccines. We were taking back our right to normalcy. But at that moment, in that time, I realized the importance of social media on informing, but often misinforming. And Jared, even my mom, never would I have thought that in the same phrase, my 87-year-old mom and bringing in social media and Instagram. I never thought those two things would ever come together, but here we are. But it made me realize how important it was to listen to their questions, acknowledge their concerns, address their questions, and really to bring her and talk to her healthcare provider, their trusted messengers, her physicians, her pharmacists, nurses. Because in the end, as I said at the beginning, it's not the vaccine that's going to save the lives. It's vaccinations. It's getting everybody confident and vaccinated and accepting their role, not just for themselves, but for the communities at large. We need everybody to be part of the solution and to normalize healthy living, in which vaccines play an important role, and stop normalizing morbidity, mortality, hospitalizations, and death.
And clearly lots happened since then, right? The pandemic officially ended in May of 2023, but we weren't in full shutdown protocols all the way up till then, as everyone remembers. What lessons from the entire period kind of stick with you today, either professionally or just life in general?
What stuck with me is that public health emergency, that PHE came to an end. The urgency around COVID, the urgency around staying up to date with one's vaccines is still as relevant now as it was then and even prior to during the pandemic. I believe we want to just forget it. Pandemic never happened. Want to put it behind us. You know what? I agree. Let's not live with that angst and concerns. We've got these vaccines. We've got these public health interventions. We need to learn those lessons and apply them to today and to maintain that healthy living. What I've taken away is, as I mentioned earlier, is that the importance of acknowledging everybody's questions, their concerns, and addressing them head on. And to allow people to engage with their healthcare provider. They're the trusted messengers. They've been treating you or your family for years. Why all of a sudden would they not want the best for you? And really to ask them your questions and concerns. We still, to this point, COVID is the leading cause for hospitalization, for respiratory virus hospitalizations in the United States and globally, far more than influenza, far more than RSV, and yet it's a vaccine that we question. I had COVID in the past. I already had a couple of vaccines. Why do I need another one? We don't ask that question for influenza. We go every year. We go every year for our influenza vaccines because we know the importance. I think it's to get to that level of reassurance around the vaccines and the role that we all play in that regard. Especially, my goodness, those individuals, how many adults have a chronic condition or comorbid condition or medical history that puts us in highest risk? I'm not talking the severe outcomes. We have diabetes, obesity, cardiovascular, respiratory, asthma. All of those conditions increase our risk for a COVID-related hospitalization incrementally. Diabetes, almost 4 times the risk of a COVID-related hospitalizations if you're a diabetic than if you're not. All the more reason to stay up to date. In those patients, everybody monitors their glucose. They monitor what they eat. They try and stay active and healthy. Vaccination is a key component to that healthy living, and it should be viewed in that manner. We've got to normalize that.
It's a key, isn't it? This is a good reminder. We haven't talked about these things for a while, and maybe we had talked about them for so long during the peak of the public health emergency that we didn't. I'm saying we. I'm definitely thinking myself. Like I was ready to talk about something else after a while. And so to come back and say, let's remember, like we need to normalize some of these things and not go so completely off the other side because we want to forget a lot of things that happened or it was a hard time. There were still some lessons there. There's still some things that were good. I mentioned like one of those, for instance, I even hesitate to call it a silver lining, right? Like the pandemic was hard. I'm not going to pretend like it wasn't. It's interesting because there are things like in those early days, healthcare made a big difference. The healthcare industry made a big difference. Their ability to collaborate and innovate at this incredible pace. Whenever we look back at other times and wonder or feel that healthcare is a little slower or it's just taking a long time to get somewhere, things are still not where I want them to be in whatever instance, we can still look back at peak pandemic and say, healthcare innovated and collaborated at maybe its greatest speed and maybe one of its greatest triumphs, right? So I feel like the speed with which vaccines were created, produced, telehealth programs were stood up in a matter of days or weeks that had taken months and years previously to even be considered. Those are all tribute to our country's healthcare system. So my hope, and I wonder what your take on this is, what will it take for us to be that innovative and collaborative again? Is it completely based on the fact that was such a crisis? And if not, like what else could be a compelling event or reason for us to come together as an industry like we did during the pandemic?
I remain the eternal optimist, and I see it day in and day out. These are lessons. They were lessons that we learned. And what it demonstrated, to your point, we could do it. If we came together, we can make this significant change. Ray, you mentioned this. The development of the mRNA COVID vaccines is something that will live and continue to support our healthcare system and the collaboration in there. In a matter of months, we were able to go from the lab into clinical trials, and it didn't come to the expense of safety evaluation. It didn't come at the expense of taking different or shortcomings to evaluate the vaccine. We put in as much robust efforts and measures to monitor the safety, the effectiveness of the vaccine, and even to ensure that at a peak time of the pandemic, we recruited the individuals in the study that were representative of the American population, of the U.S. population, by diversity in terms of race, ethnicity, age, region. We made sure that was there so that all of this information can help support the best possible decisions. Those are lessons that we continue. We continue now in our clinical development programs, in our clinical trials. We are ensuring that those that we enroll, no matter the trial, a representative population, so that we find the individuals in our trials, it's representative of the U.S. population. That we take into account the telehealth situation. We're maximizing what we can do with the data sets and data sources and the reach to patients, facilitating their involvement and recruitment into trials, making it less onerous and more pragmatic. So these are lessons that we continue to have. And the collaborations with public health. Jared, last year, we did a paper. We wrote up something akin to what we're talking about. We wanted to look at the 23-24 COVID season and say, let's look at lessons learned. What did we learn that we can do better for 24-25? And we looked at a few elements operationally in terms of when the vaccine decisions are made for what goes into the vaccine, the decisions for the recommendations and the evaluation, the availability of the vaccines. I spoke that at the beginning, I wanted to be able to do something to help bring us out of that pandemic. And that's what brought me to Moderna. The promise of this platform, I have never seen the promise delivered so much than in what we do at Moderna and what this mRNA platform can deliver. Imagine that, and this is what facilitated the implementation and the rollout of the vaccine, so that they were timed at the same time last season when influenza vaccines were available, COVID vaccines were available. So you can get them together. When you think about it, though, the decision and the recommendation and discussion by the FDA in terms of what is the variant that goes into that vaccine for the upcoming season wasn't made in February like it is with influenza vaccines that are on that more traditional platform, even grown in eggs. It was made in June. We found out what was going to go into the vaccine in June 2024. The ACIP made their recommendations at the end of June, and we were able to manufacture and deliver tens of millions of doses into the system by the end of August. That is only possible on this mRNA platform. And this holds the promise moving forward. It's not just for COVID. We can accommodate that schedule. And that's one of the lessons learned, to ensure that platform is there so that we can respond to the seasonality and make sure that our vaccines are as close a match to what's circulating. This is a virus, Jared, that we measure the mutations not on a monthly or yearly basis, but on a weekly basis. And so to be able to have a vaccine developed, manufactured, and brought into the system as close as possible to when it's actually getting into the arms, and it's close a match to ensure that maximal level of protection, that's an incredible learning, and operationalizing it is a collaboration between industry, public health, the distributors in the system, the primary care providers, pharmacists and physicians, health systems, all of us coming together. So I think moving forward, that is something that's already there. And we can leverage that for other respiratory illness, for other vaccines such as influenza, and we're working on an mRNA-based influenza vaccine.
I think the word normalizing, I'm going to keep coming back to that. I can see that's still our quest or our mission here. I'd like to dive into long COVID a little bit. What do you want people to understand about long COVID, with March also being Long COVID Awareness Month?
We have learned a tremendous amount in the last few years around long COVID. And there's still so much more to know. I think people need to recognize that this isn't just this is a real illness. It is a real outcome from COVID that affects millions of people every day, millions of Americans every day. Right now, the latest statistics, the latest counts is about 5%, 5.5% of the adult population in the United States are currently experiencing an episode of long COVID. That's close to 14 million American adults right now are experiencing actively a bout of long COVID. And the majority of them have some degree of disability or impact on their activities of daily life. When you think about what long COVID, it's a plethora of symptoms from brain fog to chronic fatigue to pain. And it's an incredible amount of impact on individuals. If we look at since the beginning of the pandemic globally, it's estimated that somewhere between 65 and 70 million people in the world have long COVID, and with more being diagnosed each day. And one might say, well, that's really in the adults. It doesn't happen in young children. Actually, we now know that even young children can have lasting effects from COVID-19 and have multiple systems and symptoms affected. There was some recent studies at the end of last year that shed an enormous amount of understanding of long COVID in children. And 20% of school-age children who had previously had COVID, this is in the United States, and 14% of them had previously been infected as teenagers, most likely had a long COVID. That's not an insignificant number of children. So it's not just an issue for adults, it's also in children. It is remarkable. It is a devastating illness that impacts millions of Americans, tens of millions of Americans on a daily basis, as we see. And when you think about it, the best way to prevent long COVID is not to get COVID. And so staying up to date with one's vaccinations, normalizing vaccines within a healthy living schedule and routine is the best way to stay healthy and active. But if you think you have long COVID, go speak to your healthcare provider. That's one of the messages that I always say. It is a real thing. It is absolutely real. It's devastating. And if you think you have a long COVID, if you've been dealing with symptoms for weeks or months, go speak to your healthcare provider. They are your trusted messenger for healthcare.
Let's look ahead. What can you tell me about where Moderna's focus, for instance, for the next short term, the next 6 to 12 months?
I'm really excited with where we're going. We have a number of vaccines in our pipeline that are coming out of phase 3 that we think will continue to help and make that significant impact on the lives of Americans and individuals across the globe. We continue to iterate. So we're looking at a next generation COVID vaccine that's even more immunogenic and more effective, especially in that older adult population, those 65 plus, those with chronic comorbid conditions in which their risk for COVID-related hospitalization and mortality increases incrementally. We can do better, but we have options. And we're excited to bring that vaccine in the next 6 to 8 months. As well, we're looking at, I mentioned at the beginning that the importance of normalizing COVID to be available, that vaccine to be available at the time when routine respiratory vaccinations like influenza are rolled out. Imagine if we could have a vaccine in which not only influenza, but we have COVID in one vaccine. So you're not getting 2 shots, but you're getting 1 shot. We have an exciting program of a combination influenza, COVID, mRNA vaccine that we're working on and we'll be discussing with the regulators and bringing in the next 12 months or so. This will help increase, we believe, and looking at the research, the acceptance as well as to facilitate the implementation of the 2 most prevalent respiratory illnesses in the United States. And to have 1 vaccine is a testament to what we can do with the mRNA platform to benefit the most individuals in the most effective manner. And it also is for the confidence, Jared. Vaccine confidence is taking a hit these days. What can we do to help support healthcare professionals in being able to have the confidence to have those conversations, to make those recommendations to their patients and to their peers and help support them? These are in raising vaccination rates across the country. That we believe is part of our mandate, especially what I do in medical affairs, is to help support healthcare professionals and public health, understand the data, the information, and really be able to give that recommendation, to have the confidence in what we're doing in terms of our research and development is at the highest standard, to show them the data, to bring the vaccines that make the most sense for them, like a COVID vaccine, like a combination vaccine, and allow them to have those conversations in a time when we're seeing rises in measles. Jared, I cannot believe we're seeing measles cases on the rise, not just in some small counties. We're now in 4 different states across the country have seen a rise in measles cases, most of which are in unvaccinated children. Measles was declared eliminated in the United States in 2000, but we now see these rises in cases, like I mentioned, mostly in unvaccinated individuals. And it's a testament to the importance of maintaining that confidence and really having healthcare professionals have that confidence to have these discussions and bring to them what they need to engage with their patients and keep them healthy and protected.
Thanks for tying together several points there and just helping us see things the way you're seeing them. I think this is super important. Last question for you, James. Kind of a fun one. We like to just ask if you could kind of recommend a guest for a future episode for us. Who would you like to hear us interviewing in the future?
Jared, and it's a tie into what I just said. Effective communications to healthcare providers and from healthcare providers to their patients, making sense of data, making sense of information, and really normalizing these conversations and increasing confidence in vaccination rates. The 2 people that I think would be phenomenal, highly engaging, incredibly knowledgeable in this space are Dr. Todd Wolin and Dr. Joe Smizer, both of whom from the Public Good Projects. They are wonderful communicators and have a wealth of knowledge around how to communicate science and raise vaccine confidence or confidence in healthcare in general to support the public health good.
All right, we'll take those recommendations, and you never know, maybe they'll appear with us here in the future. But James, it's been such a pleasure. Thanks for joining us today. Thanks for everything you're doing to make healthcare consumer-centered. We appreciate it.
Jared, I have to say a huge thanks to you and your colleagues. It's not easy being on the front line as a healthcare journalist and communicator, and what you do is bringing that information to light, the transparency and supporting individuals in understanding what's going on and really bringing that confidence together. So I thank you for all the wonderful work you are doing and continue to do.
Thanks so much, James. It was truly a pleasure.
Thank you.